more money if people are sick.
Well, I mean, think of it this way. If you're Lloyd's of London, do you want one ship, and you're insuring all the ships in the ocean, do you want one ship to sink a year, or do you want 1,000 to sink? If 1,000 sink, everybody's going to be paying you premiums to insure themselves against that eventuality. And you're making money on the friction. So you're making the money that comes into this. You're making your money on the money that comes into the system. So the more that you pump up that volume of money, the more you make. So, nobody is interested, nobody is economically incentivized to make people well, and we are not going to get well until we align those economic incentives with the health outcomes that we want, which is nobody gets sick. We end the chronic disease epidemic, and that's what we're doing now. We're trying to realign all those perverse incentives that reward you. For example, the medical system pays out on fee-based service. That means that the more tests the doctor orders for you, the more drugs he prescribes you, the more contact he has with you, the richer he gets. So he is not incentivized to get you well. We ought to be paying him a flat fee at the beginning of the year and saying any cost from this patient, the rest of the year come out of your pocket. And then he's like, okay, how do I get this guy from getting sick? And he starts studying nutrition books and,
That's actually an interesting idea. It seems so captured at this point. It's going to be difficult to unravel all that.
It's difficult, but it's not impossible, and we're doing it.
Well,
but
I think
3 years from now, you're going to see a different healthcare model in our
think
country.
talking about it has a big impact because most people are just not aware of how the whole system works and what is actually wrong with it. Most people just hear about it. Healthcare, people are sick, they need healthcare. Why would they cut healthcare? Cutting healthcare is bad. That's what they would just immediately think. And I think most people they think